happy Wednesday to you. Now, May is National Stroke Awareness Month, and for the next couple weeks, we're going to empower you with some vital information that could save your life or someone you love. Dr. Rob is in the house today to break down exactly what happens to your body when you're having a stroke. Dr. Rob, very important topic. So let's start with the first question. I know I'm curious about this. What exactly is a stroke?
Well, that's a great question, Vanessa, and there are a couple different kinds of strokes. We have a kind of stroke where we actually get a clot and it blocks off the artery and you can't get blood, and I know we have an image that we're going to be able to look at here.
And what is that stroke called?
And here we have it on the screen right now. You see where this clot has blocked the bifurcation of the artery and blood isn't getting to the brain, and you're having a stroke or a brain attack, and this is an ischemic type of stroke. Next, we have what's called a hemorrhagic type of stroke. And you can see where the blood vessel has ruptured in this graphic here, and there's bleeding into the brain. This is a hemorrhagic stroke. And then we have another kind which is called a transient ischemic attack. You can see the clot has blocked off the blood supply, but it doesn't last very long. It breaks up and then filters through, and the oxygen in the blood gets back to the brain. So you have symptoms just for a small amount of time. So those are the different kinds of strokes that we can have, Vanessa. And they're all just as serious. I
was going to ask, I mean, no stroke is good, but which is, I guess, the least detrimental?
There's no such thing as one that's least detrimental.
Okay, so
I mean, if you had a choice, I guess the transient one where it's just...
You have the effects and it goes away.
But those can be warning signs that an impending,
more
serious stroke is coming. So you have to take transient ischemic attacks as serious as a full-fledged stroke.
Okay, and what are the warning signs that you are, in fact, having a stroke?
Well, there's lots of different warning signs. We can see sometimes numbness in an arm or a leg, or the inability to use an arm or a leg, sudden confusion, trouble speaking. Some people will say they have trouble seeing out of one or both eyes, maybe some dizziness, trouble walking. Sudden onset of a headache without any cause could be the signs of a stroke.
And how long should those symptoms persist?
Well, if they start to happen, you want to act immediately. And we're going to talk about some of the things that you should do if you think a loved one, family member, friend is having a stroke. Because you want to act fast, because time is brain. And the faster you can get to help, call 911, get into the emergency room and get treatment for the stroke, you can save brain tissue, which means you could recover from the stroke. The longer the brain goes without oxygen, the worse the symptoms can be and the worse the recovery can be.
Certainly. I know I mentioned to you before we went on air, my grandmother actually had a stroke, so I guess I have a family predisposition to having a stroke.
You do. Having family history, Vanessa, of having a stroke and being an African-American female makes you a higher risk for stroke as well. And if you do things like smoke, drink too much alcohol, don't get enough exercise, or have some other problems like you might have a hole in the heart or atrial fibrillation, which is an arrhythmia, or you eat too much trans fatty foods, which isn't good, and you don't exercise, all can be things that can lead up to having a stroke. So what do you want to do? You want to eat healthy. You want to drink plenty of water. You want to get out and eat your fruits and vegetables, but make sure you get out and get exercise. Don't smoke. One of the best things you can do for your health is stop smoking, people, because it causes inflammation, and inflammation can lead to strokes.
Certainly.
So what do we want to do? We want to act fast if we think someone's having a stroke. And I know we have another graphic here that we can show. What we're doing is we want to act fast. So F stands for face. Ask your loved one to smile. Put on a big smile, because if they have trouble smiling or sticking out their tongue and it wants to go to one side, that's a sign of a stroke. Ask them to raise their arms. Can they move their arms? Can they move their legs? The inability to move an arm or a leg is a sign of having a stroke. Then ask them to say something. Speak a phrase. You know, BP, DT, KQ. Can they repeat the alphabet? A, B, C, D, E. If they can't do it, those are signs of having a stroke. You have to act fast. Call 911. Get them to the hospital so they can get definitive care and treatment so that we can save brain tissue.
There we go. Dr. Rob, thank you so much for being here. And again, you are kicking us off. Next week you'll be back. I think Sean is going to get a sneak peek at a one-of-a-kind instrument you have here in the Miami Valley to help folks who may be susceptible to having a stroke.
We have a very interesting machine that we're going to show that measures inflammation in the arteries. One of the earliest signs that you could have a heart attack or stroke.
There you go, just a teaser. And talking about Sean, Sean is taking us inside